Hi, the following is a demonstration of the balloon sinuplasty using an aluminum light cable and an endoscope to open up the sphenoid sinuses. This patient has chronic sinusitis refractory to medical treatment involving multiple sinuses. His CAT scans show bilateral sphenoid disease, and an MRI shows also the sphenoid sinuses are partially blocked and inflamed. Approaching the left side first, the middle turbinate is outfractured gently with the caudal freer. The superior turbinate is seen at the tip of the freer. The septum is on the left. Image guidance is also used to help identify the sphenoid ostia, but is not placed through it in order not to damage the natural ostium. We see the area of the sphenoethmoidal recess where there's polypoid disease at the area of the sphenoid ostium. The 0-degree guide catheter is brought into place. The aluminum light cable is going to be passed through this to try to cannulate the natural sphenoid ostium. Several attempts may be required. This is done under direct endoscopic view. You see multiple times that the probe is just not cannulating correctly. At this point, though, the probe does make it into the natural ostium. It is felt on palpation and direct visualization. The guide catheter is slightly moved back out of the way so the balloon catheter can be advanced through it. At this point, we're also going to see that the light guide is seen in the sphenoid along the floor. The balloon is now being advanced into the sphenoid. We see the light probe is on the floor of the sphenoid, indicating that we're in the right place. Once the balloon is felt to be in the right position, it is inflated. This balloon is 5 by 24 millimeters, which is slightly large for the sphenoid, but is also needed for the frontal. The balloon is inflated incrementally to about 6 to 8 atmospheres, and then the balloon is deflated. This is all done under direct endoscopic visualization. At this point, a modest opening of the sphenoid ostium is made. Some polypoid material is seen around it. A second pass was elected to be performed, and at this point, an excellent opening in the sphenoid was created. Some polypoid material can be removed, but care must be taken in not injuring the artery, which is right below it. The right side is done in a similar fashion. The turbinate is gently outfractured. The 0-degree guide catheter is put in position. The light probe is now advanced to try to cannulate the ostium. We can see the light is behind the wall, indicating it's in the sphenoid sinus. The balloon is now brought into position and brought out of the guide catheter over the lumina guide cable. The balloon is now inflated under direct visualization. We can see air coming out of the sphenoid sinus. We can see the light probe in its position. The balloon is deflated and removed, and we can see that the opening that has been created is more than adequate. We can see into the sphenoid that there's mucoperiosteal thickening. The advantages of the balloon sinuplasty is that there's no tissue removal or bleeding. It's less painful. The patient can resume quicker activities. There's much less chance of scarring the natural ostium, which is the key to this procedure.